If a young female comes with a complaint of irregular or no periods, abnormal hair growth, or increasing weight, then our first diagnosis is Polycystic Ovarian Syndrome, PCOS. What is PCOS? Polycystic Ovarian Syndrome is a common hormonal disorder affecting women of reproductive age, characterized by irregular menstrual cycles, hyperandrogenism, and polycystic ovaries. Prevalence of PCOS: it affects approximately 5 to 10% of women of childbearing age. Pathophysiology: following factors can contribute to PCOS: hormonal imbalance, elevated levels of androgens, male hormones, and insulin resistance contribute to the symptoms of PCOS. Ovarian dysfunction: multiple small cysts develop on the ovaries, often caused by disrupted follicular development. Risk factors leading to PCOS: genetics, family history of PCOS, insulin resistance, often associated with obesity, and can lead to type 2 diabetes and cardiovascular events. Lifestyle factors: diet and physical inactivity can exacerbate symptoms. Symptoms of PCOS: patient can show following symptoms: menstrual irregularities, infrequent, irregular, or prolonged menstrual cycles, hyperandrogenism, hirsutism, excessive hair growth on the face, chest, and back, acne, severe, persistent acne, alopecia, thinning hair or male pattern baldness, polycystic ovaries, enlarged ovaries with multiple small follicles. Other symptoms: weight gain, difficulty losing weight, and skin changes, such as darkening of the skin. This darkening is called acanthosis nigricans. Diagnosis of PCOS. Step 1. Clinical assessment. Medical history. Detailed history of menstrual cycles, symptoms of hyperandrogenism, and family history. Physical examination. Examination for signs of hirsutism, acne, and obesity. Step 2. Laboratory tests. Hormone levels. PCOS can show following abnormalities: elevated androgens, testosterone, DHEAS, high LH to FSH ratio. Ratio can be as high as 2 to 1 or even 3 to 1. It is only 1 to 1 in normal females. Other hormones: prolactin, TSH, and cortisol, to rule out other conditions. Step 3. Imaging studies. Transvaginal ultrasound to visualize the ovaries and check for the presence of multiple follicles. Diagnostic criteria of PCOS. Rotterdam criteria requires 2 of the following 3 features: oligo or amenorrhea, irregular or absent menstrual periods, clinical or biochemical signs of hyperandrogenism, polycystic ovaries. On ultrasound. Management. Step 1. Lifestyle modifications. Diet. Low glycemic index diet, rich in fruits, vegetables, lean proteins, and whole grains. Exercise. Regular physical activity to improve insulin sensitivity and promote weight loss. Weight management. Achieving and maintaining a healthy weight to help regulate menstrual cycles and reduce androgen levels. Step 2. Medical treatments. Oral contraceptives, combined hormonal contraceptives to regulate menstrual cycles and reduce androgen levels. Anti-androgens. Medications like spironolactone to reduce hirsutism and acne. Insulin sensitizers. Metformin to improve insulin sensitivity and help with weight loss. Fertility treatments. Clomiphene citrate, letrozole, organodotropins to induce ovulation in women seeking pregnancy. Step 3. Surgical treatments. Ovarian drilling, laparoscopic procedure to induce ovulation by destroying a small portion of ovarian tissue. Complications of PCOS. Infertility due to anovulation, metabolic syndrome, increased risk of obesity, insulin resistance, type 2 diabetes, and cardiovascular disease. Endometrial cancer, increased risk due to prolonged unopposed estrogen exposure. Mental health issues, increased prevalence of anxiety, depression, and eating disorders. Prognosis. Long-term management. PCOS is a chronic condition that requires ongoing management and lifestyle adjustments. Early intervention, early diagnosis and treatment can help manage symptoms and reduce the risk of complications.